Hello, everyone. This is Physio Meghna Dave. For all the Instagram viewers, this is the first live session that's happening on Instagram. On YouTube, I've anyways done a lot of Instagram live sessions. But for Instagram viewers, this is for the first time. So basically, what we are going to do is we are going to take up some of the questions. So I'm live on Instagram as well as on YouTube. So on my laptop, it's the YouTube platform is open, and on Instagram also the platform is open, and I'm available here to answer all the questions that you have got related to your health. So make sure to share your questions, ask me anything that you would like to ask related to your health. Hi Swati, hello Sagar, thank you for joining in. Thank you. So I hope you all are safe and fine. Good afternoon, hello, good evening. I know it's been a long while I've come live, so today I was a kind of free, so I thought let me just do a live session. It's been a long time I've not interacted with you guys. So yeah, I'm here. So feel free to ask your questions. Hi Anurag. Okay, so what shall I talk about today? Bell's palsy, cerebral palsy, back pain, knee pain, shoulder pain, anything related to your health concerns? Do let me know what you would like to hear. Hi, Kampi. Hi, Rishu. Yes, Rishu, I received your email and I guess I've replied it as well. Dedicated series on ataxia. For sure, I'll do a dedicated series on ataxia. Medicine for inflammatory gastritis due to Kashi. Really sorry, I'm a physiotherapist by profession, so I wouldn't be able to talk about medicines. And in general, also, I would advise never take medicines without prescription. So make sure to take care. Rishu, I have replied to your email. I have replied. I saw your email and I have written that you can directly contact me and we can have a one-on-one communication. Hello, Sony, cerebral palsy, Bell's palsy. Okay. Hi, Urmi. Okay, so now somebody is asking how much time it can take to have neck control in CP kit for 2 years old. Alka, this is a very generic term. Every child is different. For some 2-year-old child, it might be like when they reach 2.5 years, and then their neck control will come under control. But for some kids, it takes more time. So it's a dependent thing. Okay, so ये हम नहीं कह सकते कि अगर एक बच्चे को 2.5 साल में नेक कंट्रोल या गर्दन पकड़ ली थी तो आपके बच्चे को भी होगा। हर बच्चा अलग होता है और हर बच्चे की जो एज होती है नेक कंट्रोल रिकवर करने की वो भी अलग होती है। तो दिस यू शुड कीप इन माइंड। स्वाति इज आस्किंग, मेरा बेटा है, उसे सीपी को 2.5 साल का है, उसकी फिजियोथेरेपी चालू है पर कोरोना टाइम की वजह से कंटिन्यू नहीं हो पा रही, उसका एक फुट ड्रॉप हो रहा है और लेग क्रॉस हो रहा है। मैम प्लीज हेल्प कीजिए। स्वाति जी प्लीज, मेरे वीडियोस मैंने बनाया, उसमें मैंने जो टिप्स दिए हैं, आपको फिजियोथेरेपी सेंटर में जाने की जरूरत नहीं है अभी, क्योंकि कोरोना चल रहा है, मैं समझती हूँ। इसीलिए आप घर पे ही लेग स्ट्रेचिंग एक्सरसाइज पे फोकस करें, उसके खड़े रहने की प्रैक्टिस ज्यादा करवाए। जितना बच्चा ज्यादा देर खड़े रहता है लेग को कंट्रोल करके, यानी एंकल फुट ऑर्थोसिस पहन के, उतना उसका जो बेसिक कहते हैं ना प्रैक्टिस ऑफ स्टैंडिंग ये होगी और उसी से इसका ये प्रॉब्लम भी ठीक होगा। मैम व्हाट इज योर ईमेल आईडी? माय ईमेल आईडी आई हैव मेंशन इन ऑल माय वीडियोस डिस्क्रिप्शन बॉक्स। I will write it here again. So it's meghana @neohealthconnect.com. And I have also shared my Instagram link. I have created a dedicated Instagram page named Health Q Media, जहाँ पे आप लोग जाके मुझसे DM यानी डायरेक्ट मैसेज भेज सकते हो और आपके जो भी क्वेश्चंस है, डाउट्स है, वो मुझसे पूछ सकते हो। ये बहुत अच्छा तरीका है और मैं इंस्टाग्राम पे भी अब से बहुत सारा कंटेंट पोस्ट करूंगी रिलेटेड टू बेल्स पाल्सी, सेरेब्रल पाल्सी, या जो भी मैं यूट्यूब पे वीडियोस अपलोड करती हूँ उसके रिलेटेड। तो प्लीज मेक श्योर कि मुझे आप फॉलो करें इंस्टाग्राम पे भी। द इंस्टाग्राम हैंडल का नाम है हेल्थ क्यू मीडिया। ठीक है, मैं यहाँ लिख देती हूँ Okay, next question लेते हैं. Bell's palsy about 2 year, 80% recovered nowadays. Eyebrows and eye also lower lip not fully work when I smile. My eyes small. What to do to recover fully? Now, yes, double G. Um, ये होता है बेल्स पाल्सी में ऐसा हो जाता है कि पार्शियल रिकवरी होती है तब जो आपका पूरा एक साइड का फेस है कंप्लीट रिकवर नहीं होता है और उस कंप्लीट रिकवरी नहीं होने की वजह से आपका जो फेस है उसमें आपको वीकनेस रहती है तो आपको क्या करना है आपको अपनी एक्सरसाइजेस शुरू रखनी है बिल्कुल भी बंद मत कीजिए एक्सरसाइजेस को शुरू कीजिए और उसी को कंटिन्यू कीजिए स्ट्रेंथनिंग में ठीक है और जो आपकी आंखें छोटी हो रही है उसका मतलब है आपको सिनकाइनेसिस का प्रॉब्लम डेवलप हो रहा है यानी कि सिनकाइनेसिस में ये जो आपकी जो आंखें है ना ये अननेसेसरीली तब कॉन्ट्रैक्ट हो जाती है जब आप स्माइल कर रहे हो या कोई फेस के मसल यूज कर रहे हो तो आपको उसको खुद इमोशन लाइक ट्रेन करना पड़ेगा आईने के सामने खड़ा रह के ताकि जब आप मूवमेंट कर रहे हो तो ये कॉन्ट्रैक्शंस ना हो. Rishu, I have replied. I will reply again for sure. Okay. Okay. So many questions are coming up. 1 minute. Let me check one by one. So I hope double G आपका आंसर मैं कर दिया है. Triglyceride is 223. Is it dangerous or normal? It is little high, so make sure that it comes under normal range. Okay, Shintu is asking, do you have any sessions for speech for cerebral palsy kids? Depends. If you need cerebral palsy child to go undergo some speech therapy session, yes, you need to go about that. But I am not a speech therapist, so I do not provide speech therapy sessions. Harchand Rai ji से कह रहे हैं my grandfather has knee fracture but knee is okay but the inflammation is in the leg is since 3 months. Then you need to make sure कि जो knee fracture है उसका recovery ठीक से हुआ है या नहीं. अगर recovery ठीक से नहीं हुआ होगा तभी inflammation रहता है so you need to constantly work on reducing the inflammation level. I hope that helped. You can take the help of orthopedic surgeon to get the proper diagnosis. Chilo is asking, ma'am, I got Bell's palsy some 3 weeks back on the left side of my face. I am 23, been doing some of the exercises on your video. How long will it take to recover? Started feeling side muscle movement. Usually, it takes 3 months to recover completely. All I would like to say is, if you are having Bell's palsy, do not overdo exercises. So, सबसे बड़ी mistake patient जब Bell's palsy होता है तब करते हैं और वो एक गलती है कि बहुत ज्यादा एक्सरसाइज ज्यादा से ज्यादा करने की कोशिश करते हैं उसके वजह से सिनकाइनेसिस डेवलप हो सकता है इसलिए बहुत जरूरी है कि सिनकाइनेसिस ना डेवलप हो और फेस को आप टाइम दो रिलैक्स होने का इसलिए एक्सरसाइज को ज्यादा मत करो पांच पांच बार मैंने 5 रिपीटेशन दिन में 2 बार ये काफी है. आई होप दैट आंसर्स. I will be quick, guys, because there are so many questions, sir. मैं चाहती हूँ कि मैं आपके सारे सवालों के जवाब दूँ. Okay. Fine. So then there is a Nilima. Doctor, my baby has CP. I wanted to ask if naturopathy could be of any help. One of the doctors suggested that magnetic therapy could be of help. What would be your suggestion? I am not sure about magnetic therapy, how much it works. Naturopathy to an extent helps, but with any sort of treatment, you cannot expect cure. One thing, I'll be very upfront here. There is no till date a proven cure for cerebral palsy because the problem is in brain. You can take the help of naturopathy or else any kind of other advanced therapy like magnetic therapy or anything to reduce the symptoms. Okay, like overall बच्चे की health को improvement के लिए आप कर सकते हो, but you cannot expect the cure. Fine. Now the next question, and will be completely recover. And will I completely recover my face on the way I was? Because part of my nose seems to be swelled up as it's a part of Bell's palsy. See, at this point, it's very difficult to tell how much you would be able to recover. Mostly, 95% of patients recover completely after Bell's palsy without any problem. Only 5% of patients are left with some residual symptoms. You have to wait and watch and see how is your recovery. Ma'am, what do you think about acupressure therapy? Acupressure therapy related to what? Like for what problem? Hi ma'am, I was diagnosed of Bell's palsy last December and up to date I still can't smile well and my eyes are still tearing. When it will be fine? That means you have got a major kind of like you are in that 5% of patients who have not received complete recovery in your facial muscles. That's why you have this persistent symptoms. What I would suggest is you need to still go to a neurologist, get yourself properly diagnosed with the help of a test which is called as nerve conduction velocity test, which identifies which nerve and to what extent the nerve damage has happened. Based on that, you might need to take some extra medication to reduce the level of symptoms. And for the tearing problem, also you need to go to an eye doctor. There is something called there is a tearing duct. Okay, so that needs to be blocked. That's a procedure which is done that helps in reducing the symptoms of eye water tearing. When it comes to facial movements, facial exercises, you still need to continue. Don't overdo the exercise. Shinto Thomas, my son is 6 years old. Could you please suggest speech therapy for cerebral palsy and visual therapy? Sir, I'm really sorry. I am a physiotherapist. I cannot guide you or give you a speech therapy. You need to go to a professional speech therapist for this problem in particular. स्वाति दुबे, मेरे बेटे पैर पे वजन नहीं लेता, उसका कारण क्या हो सकता है और सीपी चाइल्ड को रिकवर होने के लिए कितना % चांस होता है? सीपी एक परमानेंट ब्रेन डैमेज है, वो जो हो गया वो हो गया, उसको आप पूरी तरीके से रिकवर नहीं कर सकते हो. हाउएवर न्यूरोप्लास्टिसिटी के अकॉर्डिंग, न्यूरोप्लास्टिसिटी एक कॉन्सेप्ट है जो रिसर्च में प्रूव हुआ है और वो ये कहता है कि हमारे ब्रेन सेल्स में हमेशा एक एबिलिटी होती है उसको रीमॉडिफाई करने की, यानी कि बॉडी अपने आप एडजस्ट करना सीखती है तो फंक्शंस जो भी हमारे डे टू डे एक्टिविटी होते हैं ना उसको करने के लिए, राइट. तो यू हैव टू कॉन्स्टेंटली डू एक्सरसाइजेस और बच्चे को आप अपनी जो उनकी डे टू डे एक्टिविटी, बच्चे को इंडिपेंडेंट बनाना, ये आपका गोल, ना कि उसका क्योर ढूंढना. ठीक है, तो जो भी बच्चा काम नहीं कर पा रहा है, आपकी कोशिश होनी चाहिए कि आप उसको सिखा पाए कि बच्चा वो काम करे. Sony is asking, ma'am, my daughter is 11 years old, cerebral palsy. She is good in cognitive skills, but no speech. If I still continue speech therapy, there is a chance of getting. Yes, of course, there's a chance. That's what I'm telling. In cerebral palsy, there should be a constant work towards the functional levels of the child. Okay, so speech therapy, you will see delayed development, but there would be a gradual development that would be seen. So for sure, you should go for speech therapy. Hello, I'm coming towards month 3 of Bell's palsy with little improvement. Do you recommend taking prednisolone? I'm not a doctor. Like you need to go to an ENT doctor to check whether you should take extra dose of prednisolone or not. I'm not an authorized person for that. Satish Mohan, hello ma'am. I'm going to complete my final year in physiotherapy. What can I choose for my higher studies? I don't have any proper idea. Kindly reply, ma'am. Thank you. It all depends on your area of interest, Satish. Please think over, sit down, ask yourself what you really enjoy doing and learn doing, and focus on doing that. मानसी मैम, मेरे को सर्वाइकल से स्टार्ट हुआ था बट नेक पेन था, बट अभी मेरे को स्पेक्युला में पेन है बहुत ज्यादा, फुल राइट साइड बैक पेन, लोअर बैक पेन, सर्वाइकल डिस्क डिफ्यूज हो गई है. व्हाट शुड आई डू? मानसी, यू नीड टू टेक प्रॉपर फिजियोथेरेपी ट्रीटमेंट, जिसका मतलब है कि आपको आपके मसल्स की जो फ्लेक्सिबिलिटी है उसको बनाए रखनी है, साथ ही साथ आपको आपके मसल्स की स्ट्रेंथ को भी बनाए रखनी है. तो ये एक बहुत ही ग्रेडेड सेशन है. आप जहाँ पे भी हो, मैं आपको रिक्वेस्ट करूँगी कि एटलीस्ट गो वंस एंड सी अ फिजियोथेरेपिस्ट एंड देन बेस्ड ऑन देयर एडवाइस आपको ग्रेजुअली इसमें एक्सरसाइज करनी पड़ेगी. एक कोई पर्टिकुलर सेट ऑफ एक्सरसाइज आप पे फिट हो जाएगा, ऐसा नहीं हो सकता आपके केस में. Tia from England, so I only speak English. Okay, Tia, I'll try to answer your question in English. What you said is you have Bell's palsy since 3 months and there's very little improvement. And do you recommend taking prednisolone? Tia, I cannot suggest you taking prednisolone because I'm not an authorized person to prescribe any kind of medication. I would suggest please see a neurologist or else a general physician, ask them, or whomever you have seen at your first time when you got Bell's palsy. And then once they approve, then only take prednisolone doses. मेहताब सिंह, हेलो मैम, मेरी भी सेम प्रॉब्लम है। मेरे फेस के राइट साइड पर वीकनेस है और स्नीज टाइम करते वक्त राइट साइड की आई बंद हो जाती है। जी हाँ सर, आपको भी ये एक प्रॉब्लम है जो है सिनकाइनेसिस, जिसमें आपको खुद को सिखाना होगा मूवमेंट्स जो होती है फेस की, उसको ग्रेजुअली यानी धीरे धीरे करना। ठीक है, ये एक लॉन्ग टर्म एक्सरसाइज है। आप 21 एक्सरसाइजेस का जो मेरा वीडियो है उसको फॉलो कर सकते हो। एक्सरसाइज सेम रहेगी, लेकिन आपको क्या ध्यान रखना है, आपको खुद को सिखाना पड़ेगा कि जब आप स्माइल कर रहे हो तो आपकी आंखें बंद ना हो। कैसे ये करते हैं? वेरी सिंपल, मैं एक टेक्निक आपको बता रही हूँ। आप धीरे धीरे जब स्माइल करके देखते हो, आप फील करोगे कि यहाँ पे दो मसल्स है। ठीक है, ये मसल्स कॉन्ट्रैक्ट होती है जब हम स्माइल करते हैं। अभी आपको आईने के सामने खड़े रह के या फिर आप खुद को रिकॉर्ड कर सकते हो, ऐसे टाइम पे आपको धीरे धीरे छोटे छोटे बार प्रैक्टिस करना है, जिसमें आपकी आंखें बंद ना होती हो। सेम वे जब आप स्माइल कर रहे हो, यू हैव टू बी कॉन्शियस। अगर फिर भी ऑटोमेटिकली अगर आपकी आंखें बंद हो जा रही है, कीप वन हैंड हियर ऐसे, तो आप यहाँ से आंख बंद होना रोक रहे हो, एंड देन यू आर स्माइलिंग। Oh, the internet connection has got. Okay, I think I'm live now. Please put thumbs up so I will get to know that I am live again. Am I visible, guys? Okay, so again, another question. Ma'am, recently I've suffered from Bell's palsy and now 2 months get over. I got full recovery except one eye looks a little bit bigger than the other eye. That means your eyes are not completely closing. You need to train yourself and do the exercises of eye close and eye open 5 times gently without any extra pressure. If you do this practice, your eyes would be fine. Okay. Next question I will take. Okay, ma'am, my son is 11 months old. He have torticollis. Can you please tell me, will it go forever? I am seeing till sometimes. You need to do stretching exercises regularly. If you do that successfully, then yes, it can be cured. Okay. Then what do you think about acupressure therapy? Again, what do you understand by acupressure therapy? Like for what problem you want acupressure therapy? Then I can tell you. Ma'am, I'm ataxia from 7 to A. Yes, I do physiotherapy exercise, but a lot of stiffness in leg. My age is 32. Yes, stiffness is about to bound to happen, Sagar. You need to see, the goal of physiotherapy in your case should be to delay the progression of the stiffness. Okay, so try to do a lot of breathing and relaxation exercises and then do stretching, then it will help. So you should equally focus on your relaxation. So do meditation on a regular basis, do breathing exercises on a regular basis, and try to incorporate some yogic posture that will be of help for you. Hey doctor, I just want to thank you for facial exercises for Bell's palsy video. It helped me, my wife a lot. She recovered completely after a month without synkinesis. She was also prescribed steroid. Great. Please give a clap for them. So somebody has recovered from Bell's palsy. Very congratulations, and I hope you stay healthy and safe in future. जर्नी ऑफ लाइफ, नी पेन के लिए एक्यूप्रेशर थेरेपी कितनी हेल्प करेंगी? नी पेन कौन से तरीके का एक्यूप्रेशर थेरेपी हेल्पफुल रहती है, बट again it's not a proven therapy, it's an alternative medicine, definitely help, but don't expect a cure from it, to be very frank. Pooja quoted, does the cerebral palsy affect speech as well? Yes, cerebral palsy affects speech as well. Nitin Kumar, ma'am, after completed my BPD course and open my clinic. Yes, you can open your clinic, but there are some norms that's related to state. So please see that. Ratanal, great social work, ma'am. I like you very much. Bless you, live long. Thank you, Mr. Ratanlal. मैम, मैं आर्ट्स का स्टूडेंट हूँ, क्या मैं फिजियोथेरेपी का कोई कोर्स के लिए एलिजिबल? नहीं, आप नहीं हो। आपको 12+2 साइंस होना चाहिए आपका, like 10+2 आपका साइंस होना चाहिए, then you have to give medical entrance examination, then only you are eligible for physiotherapy course. Swati Dubey, thank you. Swati Bajpayee, ma'am, CP के लिए stem cell therapy is good or not? Yes, it is good, but it is very expensive and there is no guarantee. Okay, so आप कोई भी therapy में guarantee expect नहीं कर सकते हो कि it will give 100% result. So it's like taking a risk like you take in any kind of treatment. But the only thing in stem cell, the investment is very huge. Like बहुत expensive होती है stem cell therapy. I have neck, shoulder, and upper back pain, also chest pain, cervical pain, spondylitis. Please help. Subrat, please take a proper physiotherapy session with a physiotherapist. Get yourself properly diagnosed. I know you have been diagnosed, but you need a customized exercise program. It's very difficult for me to tell you in right moment what all things you should do because there is so many things you need to do that it will get really long. So I would suggest please see a physiotherapist. विवेक प्रसाद, मुझे लोअर बैक पेन था राइट साइड में, तो मैंने आज ही कायरप्रैक्टर को दिखाया और एडजस्टमेंट भी करवाया, तो कोई प्रॉब्लम तो नहीं होती एडजस्टमेंट? नहीं नहीं, कोई प्रॉब्लम नहीं होती. कायरप्रैक्टिशनरी इज प्रूवन साइंस एंड इट ऑल डिपेंड्स ऑन गुड हैंड. अगर वो डॉक्टर अच्छे हैं तो आपको कोई दिक्कत नहीं होगी. हाय मैम, गुड इवनिंग. हेलो, थैंक यू सो मच, वेलकम. In regard to Bell's palsy, is the slight muscle movement an indication that the nerves start to heal? Yes, it is an indication that your muscles have started to heal. How do I tell that I'm starting to get better? The moment you start getting contraction on your face, that's the sign that you are getting better. As Dhali, I have been suffering from Bell's palsy since tomorrow morning. Okay, I can do anything properly except the closing of my eyes. Went to doctor, they gave me medicine. What else I should do? Will I be cured? Yes, you would be cured, don't worry. You need to take care of your eyes. Make sure to tape your eyes completely. I have a video on eye care for Bell's palsy. Make sure to watch it, follow all those instructions. Make sure to protect your eyes while you go out. And then apart from that, do some gentle facial massage, gentle facial movements. And if you feel that difficulty in closing eyes is there, you can gently stretch your eyelids and bring it down like this. This is what you should do in order to prevent the eye incomplete closure. Okay, next question. Sakshi. Ma'am, actually, it's been 3 months since I was diagnosed with Bell's palsy. There are some residual effects left. What should I do? Please see a physiotherapist. That's the best thing I can tell you. You need a proper guided exercise program for you. If you want, you can take my help. You can reach me out on my Instagram, DM me, or else you can email me. I've shared my email ID as well. We can have a one-on-one consultation, and then if you need any help, I can help you out. स्वाति दुबे, आपसे बहुत ही पॉजिटिविटी मिलती है क्योंकि एज अ सीपी पेरेंट बहुत लोग तरह तरह की बातें करते हैं और डिमोटिवेट कर देते हैं, पर आपका सपोर्ट बहुत हिम्मत देता है. थैंक यू स्वाति. आई होप मैं किसी भी तरीके से आपकी हेल्प कर सकूं, मुझे बहुत अच्छा लगेगा क्योंकि मैंने सब पेरेंट्स की जर्नी देखी है. मैं जानती हूँ एक सीपी बच्चे को रेस करना बहुत डिफिकल्ट होता है और मैं कोशिश कर रही हूँ, काम कर रही हूँ कुछ ऐसा लाने का जिससे पेरेंट्स घर पे रह के ही अपने बच्चों को हेल्प करें. मैं अभी रिसर्च फेज में हूँ इसलिए अभी कुछ अनाउंस नहीं कर पाऊंगी, लेकिन यस, जिस दिन मेरे पास एक बहुत ही थरो प्रोग्राम होगा मैं आप सभी लोगों के साथ जरूर शेयर करूंगी. सुनील बाबू, my knees makes clicking sound and sometimes it's painful. Shall I continue jogging or I need to quit running? You don't need to quit running. Maybe what you need to do is a proper warm up before doing your jogging. Make sure you do warm up plus stretches and also work on improving the strength of your knee muscles. That means the quadricep muscles. That would be of help for you in order to prevent the clicking sound as well as the pain. Ma'am, can you please tell me about torticollis? My son have it. Sir, I have made a video on torticollis. Please watch it. It's there on my YouTube channel. I've detailed in a detail. I've explained, and I've also shown some of the stretches that you can do. If you want individual help, you can reach out to me. We can have a consultation, and then I can help you out further. Manish Rai, बाएं पैर में बहुत दर्द, इसका क्या इलाज है? सर, आपको पहले तो पता करना पड़ेगा ये दर्द क्यों है, इसलिए आप पहले डॉक्टर को दिखाइए, प्रॉपर डायग्नोसिस करवाइए, उसके बाद मैं आपको बता सकती हूँ कि आप इसके लिए कौन सी एक्सरसाइज कर सकते हो. Damarian, hi, good day, ma'am. About Bell's palsy, can you diagnose, look for it because I want to fully recover? If you want, we can have video consultation where I can check you and tell you. But before that, I would suggest please see a physician or else a neurologist, get a proper diagnosis done, understand at what stage you are in, and then based on that, you should do your exercises. Do I want to do MPT, or is there any other courses that I can do to pursue my higher studies, ma'am? MPT, yes, MPT, of course, you can do if you are interested in doing any kind of like management studies. You can go into MBA as well. Okay, where is the question? I think I lost. ओवरऑल एक्यूप्रेशर थेरेपी के बारे में क्या सोचते हो? ट्रीटमेंट जैसे आयुर्वेदा है, होम्योपैथी है, एक्यूप्रेशर है, ये सारे थेरेपी प्रोग्राम्स हैं। यस, काफी पेशेंट्स में इसका बेनिफिट मिला हुआ है, यू कैन ट्राई, बट इसकी जो क्लिनिकल रिलेवेंस है, यानी हर स्टडीज में ये कितना प्रूवन है एज अ ट्रीटमेंट फॉर्म, ये मैं सही पर्सन नहीं हूँ आपको बताने के लिए, क्योंकि आई एम नॉट ट्रेन्ड इनटू इट, टू बी वेरी ऑनेस्ट. Okay, then while clicking popping sound, while kicking a popping sound is coming over my knees. Why? That's because your knee cap bone is not properly placed. It's not in right position. So you need to make sure that you do a good combination of stretching and strengthening exercises of your knee and leg muscles to bring it back to normal. Ma'am, reduce toe walking, 4-year-old son. Stretching, first thing. Second, wear ankle, knee, ankle, foot orthosis. Third thing, standing practice. Fourth thing, walking practice. 4 things are the most important things in order to improve that, reduce the toe walking in your child. Hi, ma'am. Uh, Hi, ma'am. My daughter has periventricular leukomalacia. She's not achieved her milestones. Now, my daughter is 2 years old. We are doing some exercises recommended by doctor. Please continue doing that. Ma'am, whenever I do squats, my knee does pop and crackle sound without any pain. That's okay. Don't worry about that. That will happen. If there is a pain, that's some problem. Otherwise, it's not a problem. My son finds difficult to convey when he wants to go to toilet. Is there any way to initiate this habit conveyed by parents? Training. The way we train a normal child, same way you have to train and teach one sign to give when he wants to go to toilet. It doesn't have to be via speech. It could be with the help of an hand expression. It could be with the help of some noise, anything. You have to train. You have to you have to show that sign to your baby whenever he is doing toilet. So as from you only he will learn, okay, then he will understand, okay, this is the sign that I need to give when I have to go to toilet, and that's how you train your baby. Okay. I can close my eyes now, but when I'm pouting, my skin in my eyes were moving like it is closing. I will do everyday exercising. Help me, ma'am. You do everyday exercising. Make sure that when you smile, your eyes should not close. For that, you need to learn isolation of your muscles. So, as I said, you have to do the smiling training, being consciously aware that your eyes are not being closed, and if they are closing, you have to stop it with the help of your fingers. I hope that answers. Mr. V, मैम 2 साल पहले मेरे को PCL एबल्शन की सर्जरी हुई थी, सिर्फ रिपेयर था, लेकिन आज तक पहले जैसा नहीं हो पाया, नी पूरा बेंड नहीं होता है, टच भी नहीं होता. सर, ये इसलिए हो रहा है क्योंकि तब आपकी फिजियोथेरेपी शायद ठीक से नहीं हुई है, आपको नी बेंडिंग एक्सरसाइजेस और ज्यादा उस टाइम पे करने की जरूरत थी. प्लीज मैं सजेस्ट करूंगी कि आप अपने ऑर्थोपेडिक सर्जन की हेल्प लीजिए, उनसे पूछिए कि इसके लिए क्या किया जा सकता है. कई बार एक रीसर्जरी करनी पड़ सकती है अगर बहुत ही ज्यादा स्टिफनेस डेवलप हो गई है. तो अगर जॉइंट लॉकिंग पोजीशन पे नहीं है तो फिजियोथेरेपी हेल्प कर सकता है. Sony, ma'am, my daughter used to walk independently in house, but due to corona, she lost everything. Balancing, she is now again bottom shuffling. Can you suggest any exercises from your videos to be done? Please make sure to do all the exercises which I have shared. It's all about practice. Whatever she used to do there, make her do again at home in some other way. But see, I always say this, it's not the exercises, it's the amount of exercises. The more repetitions you do, that is more important. Okay, so there's no other magic exercise for any problem. It's just the same. All you need to do is do it in right way, for more frequency. Now, where can I get your email address? In all my videos, it's there. I will type again @meadowhealthconnect.com, or else you can follow me on Instagram at HealthQMedia Instagram handle, and we can talk. I am in Bangalore right now. I'm not functioning offline. I would tell you, like I'm only doing online consultations because there was a small accident that has happened in our clinic, due to which our clinic is shut down right now. So while clicking and popping sound is coming from my knees, why? As I said, it's because of the improper position of your kneecap bone. Okay. Hello, thanks for your best palsy video. I am on 4th week. My mild smile is already functioning. Eyebrows too. My white smile is still very weak. Don't worry, it will come back to normal Marco. Sorry if I pronounced it right. स्वाति दुबे मैम सीपी चाइल्ड की मालिश करना चाहिए या नहीं, क्योंकि बहुत लोग मालिश की सलाह देते हैं. मालिश करनी चाहिए, सही तरीके से करनी चाहिए. सही तरीका ये है कि शुरू आप हाथ में अगर कर रहे हो तो हाथ से करो, सेंटर तक के ले जाओ. पैर में भी कर रहे हो तो पैर के पंजे से करो, सेंटर तक के ले जाओ. ये रूल को ध्यान रखिए और मालिश कीजिए, कोई दिक्कत नहीं. विवेक प्रसाद मैम, डॉक्टर ने गिव अप कर दिया है. अब इसका ज्यादा इम्प्रूवमेंट नहीं हो सकता. पीसीएल में रेंज ऑफ मोशन इतना ही रहेगा. ओके, you can see two other doctors, take second consultation, क्योंकि in PCL it's about the internal structure. Okay, as a physio हम लोग मसल्स पे काम कर सकते हैं. अगर लेकिन बोन लेवल पे ही अगर प्रॉब्लम है, लिगामेंट लेवल पे ही प्रॉब्लम है, तो वी वोंट बी एबल टू हेल्प यू मच. फर्स्ट यू नीड टू सी. सो मैं चाहूंगी कि आप 2-3 सेकेंड ओपिनियंस लीजिए ऑर्थोपेडिक सर्जन के और जानिए कि इसके लिए क्या बेहतर हम कर सकते हैं. हेलो बुलर. स्वराज मैम, मुझे एलर्जी की सर्दी है और मुझे थोड़ा सा दम लगता है. स्वराज, इट्स द सेम प्रॉब्लम दैट आई आल्सो हैव. इट्स अ सीजनल थिंग, बट अनफॉर्चुनेटली मैं इसकी एक्सपर्ट नहीं हूँ, इसलिए मैं आपको कुछ ज्यादा गाइडेंस इसमें नहीं दे पाऊंगी. Mallar, ma'am, I am suffering from diabetes. What should I do? You need to see a physician. I am not a physician. I am a physiotherapist, so I can help you out in that. Ravindra, ma'am, I am recovered. Bell's palsy 85%, 6 months complete now. Okay. Hi, Divya Pravina. Hello, Instagram guys. Please, one request, please follow me on Instagram. My Instagram handle is HealthQMedia. Please support me there. I'll be posting a lot of content there as well. मैम BPT और MPT के अलावा और कोई कोर्स है, लाइक डिप्लोमा कोर्स? जर्नी ऑफ लाइफ, आई एम रियली सॉरी, मेरे को कोर्सेज के बारे में ज्यादा जानकारी नहीं है. मैं सिर्फ अपना बता सकती हूँ. मैंने मेरा बैचलर्स ऑफ फिजियोथेरेपी किया हुआ है और उसके बाद मैंने मेरा मास्टर्स ऑफ फिजियोथेरेपी किया था. जो किया था मैंने न्यूरो साइंसेस में, इसलिए मेरा, आप मेरे वीडियोस भी देखोगे वो न्यूरो फोकस ज्यादा होते हैं क्योंकि वो मेरी स्पेशलिटी है. और मुझे इसके अलावा ऑनेस्टली स्पीकिंग कोई कोर्सेज के बारे में ज्यादा जानकारी नहीं है, क्योंकि मैं स्किल्स पे बिलीव करने वाली इंसान हूँ. मैं जानती हूँ कि कोर्सेज ज्यादा आप क्या सीख रहे हो और उसको कैसे इम्प्लीमेंट करते हो, ये ज्यादा इम्पोर्टेंट है रादर देन हैविंग एनी सर्टिफिकेट. सो जस्ट थिंक आपका क्या इंटरेस्ट है और टेक अ कोर्स अराउंड इट एंड जस्ट डेवलप दैट स्किल. पेशेंट आपको आपके स्किल यानी आप उनको कैसे ठीक करते हो उस पे वैल्यू करेगा, ना ही आपकी डिग्री देखेगा. ओके, सो दैट्स व्हाट माय एडवाइस आई वुड लाइक टू गिव. स्वाति दुबे, सीपी चाइल्ड की मालिश कर सकते हैं या क्या मेरा इंटरनेट कनेक्शन चला है? या हाँ, सीपी चाइल्ड की मालिश आप बिल्कुल कर सकते हो, करनी भी चाहिए. ध्यान रखिए, हाथ से शुरू कीजिए, अंदर की तरफ ले जाइए. पैर की भी कर रहे हो तो पंजों से शुरू करके आप अंदर की तरफ ले जाइए. दैट्स इट. Could you please suggest any breathing exercises? Breathing exercises are very simple. Ask your child to breathe in from your nose, breathe out from the nose. Idea is बच्चे के हाथ पे, like ask your child to keep a hand on the tummy. So when he breathes in, the tummy should go out. When he breathes out, the tummy should go in. That's the basic formula. I've made one video on breathing exercises. You can follow that. Ma'am, मुझे Bell's palsy हुई. Okay. Ma'am, I have pain in my left side SI joint. What can I do? Exercises. I have made a video. Please watch that. मैम एम्स की स्पोर्ट्स इंजरी सेंटर में भी दिखाया, वो लोग भी सेम वही बात बोल रहे हैं. आई एम रियली सॉरी अगर दैट केस एवरीबॉडी सेइंग दैट maybe you have to deal with that. What you can work is you can work on improving your strength of the leg muscles. Okay, Sunita is there. Ma'am, it's almost 5 months completed. I've recovered from Bell's palsy 95%, but even now my eye gets strained and I get eye infection. That means your eyes are not closing completely. So what you need to do is you need to regularly focus on eye closing exercises. That is very important. Okay, next question. Shama Hina. Ma'am, I got Bell's palsy in March, took medicines and physiotherapy. I have slow recovery. How? I have no movement in forehead and lips. Please suggest. Okay. You need to continue doing your facial massage, facial stretching, and passive exercises for your facial muscles. That will be helpful for you. I hope that answers your question. Now let's take the another question. मैम मेरा बेटा 3 साल का है, walks with bent knees, always sit kneel sitting position, can't sit cross leg. What should I do? You should do more stretching exercises for the leg muscles. That's the ultimate thing that is required. Hi ma'am, Bell's palsy lower lip process very slow. What can I do in 4 months? You need to practice more exercise, but with more, I don't mean that you should do 50 repetitions, 5 repetitions 2 times in a day, but do it consistently every day. Can you share your contact? I'm really sorry I can't share my contact number. I have shared my email ID already. If you have any problem for which you need to contact, you can just email me. Ma'am, does chewing gum also help in recovery of 3 weeks old? If you are 3 weeks old, Bell's palsy, don't chew, don't do chewing gum. Just wait. Don't put any extra stress on your face. Let the recovery happen on its own. Just do more of facial massage, facial stretching, and gentle facial exercises. Don't do anything extra. Should I suffering from DDD? Last 4 years, it is curable. DDD, can you just elaborate a bit? What do you mean by DDD? Hello, everyone on Instagram. Okay, hi, I'm suffering from Bell's palsy from 2 months, stopping physiotherapy, but it's not fully cured. Doctor suggests that stop the physiotherapy, no problem. Or to stop the physio, what can I do, ma'am? See, you can continue exercises and you should continue exercises. Ma'am, ataxia mein diet plan, please. I would try to bring in some diet related advice for ataxia. I would try to bring in some expert into that because I am not a diet expert, so I can't tell you much about diet part. Disc degeneration disease. Okay, this degenerative disease. It's like depends what kind of disc degenerative disease is there, what symptoms you are having. So probably you need to do some exercises that's focused towards improving your posture at the same time improving the strength and flexibility. Ma'am, can sarcoidosis can be treated without medicine? Doing exercises you recommend, please? Yes, exercises are important, but sometimes if inflammation is too much, you need medicines to aid the effectiveness of the exercises. Ma'am, orthopedic की medicine की क्या sense होती है? In the sense, I didn't get it. Orthopedic मतलब क्यों medicine दी जाती है? बहुत सारे reasons होते हैं medicine देने के. I can't tell you like क्यों दी जाती है. It's multiple things that happens. I'm sorry, I can't give you my WhatsApp number. If you want, you can email me or else you can contact me. You can DM me on my Instagram handle. It's in HealthQ Media. You can go on Instagram. आप Instagram पे जा सकते हो और वहाँ से आप मुझे एक direct message भेज सकते हो या फिर आप मुझे email कर सकते हो. Okay, guys. So I hope आज का ये session helpful रहा. I tried to answer almost all the questions. If you still have any questions, please reach out to me by sending a direct message on Instagram or else you can email me. I would come back to you for sure. Okay, guys. So, okay, I'll just take two more questions. मैम आपकी हेल्प की ज़रूरत है सर, आप मेरे वीडियोस देखिए, मैंने पूरा ऑलमोस्ट आपको बताया हुआ है। फिजियोथेरेपी से आप नेचुरली कोई चीज़ को हील नहीं कर सकते हो। सी यू नीड टू स्टिल अंडरस्टैंड व्हाट इज फिजियोथेरेपी। Okay, so please take your time, learn and understand. It's not about natural healing. Physiotherapy aims in correcting, it's more of rehabilitation. My Instagram name is HealthQ Media. ये मेरा Instagram handle है. You can reach out. This is an Instagram handle. Okay, guys, so I'll take a leave now. I'll see you sometime again as the time allows. So, thank you so much. Bye bye.